Welcome to another episode of the Your Company Health podcast. My name is Andre Wright, and today we have Dr. Narendra Singh, a renowned cardiologist here in Georgia and throughout the U.S. Doctor, welcome, and how are you?
Oh, very good. Thank you so much for having me.
I'm excited to talk with you. So I want you to tell us, just to get things going, tell us more about your story and why cardiology.
Well, that's interesting because, I got interested in medicine right out of high school. I trained in Canada in Halifax, Nova Scotia. And one of the things that you realize is just the impact individuals have on you. So when I got into medical school, one of my close family friends, almost like a second dad to me, was an anatomy professor there. And he taught me all my anatomy, was so proud of me, but ultimately he never got to see me graduate. He died of a heart attack before I graduated. Uh, South Asians have a lot of heart disease, and we get it at an early age. And so that had a major impact on me. Obviously, many other family members have been afflicted by heart disease, and all of that made me want to go into that specialty. And then when you're actually experiencing that, you get various mentors that teach you, and their passion often, then some comes to you. And so I had an amazing physiology professor that he was so excited about the heart, and that got me very excited. And then I did some training in Boston at the Brigham and Women's Hospital, which is one of the meccas of cardiology, and you couldn't help but get excited about the field.
Nice, nice. So, and by talking to different, healthcare providers, it's the story's always the same. There always is some influence in the back end, that will propel you to start the journey. But talk to us about your practice. Firstly, how did you get to Georgia?
Okay, so I finished med school in Halifax, Nova Scotia, and then I decided I wanted to go to Toronto. That's our biggest center in Canada. I did all my internal medicine and cardiology training there. I actually practiced there for about 8 years, but I was married, and my wife was from Atlanta, and she did not like the Canadian winters. And so Atlanta looked like an appealing destination. In 2002, came down here and have been here ever since. And, have worked at a couple of different practices before moving on to my own practice. And I'm a rare breed now in this world where cardiologists usually join major hospitals and are employed by the hospital, but I still function independently of the hospitals, even though I work out of a number of them.
Right, right. And doctor, I know we know the statistics, and you can share more about heart disease and the US and the world. So, doctor, why is it so prevalent? As they call it the silent killer, right? Why is it so prevalent? And people are listening. What can we do more of to reduce or to be more healthy?
I think that's such an important question because first of all, what I practice is preventive cardiology. Our goal is to prevent that heart attack from happening, prevent you from needing a stent, prevent you from needing a bypass operation. And one of the scariest statistics is that even during the pandemic, both here in the US and across the world, heart disease was still the leading cause of death. And it just points out just how prevalent it is. And part of the reason it's prevalent is some of it's a success story. We have gotten very good at treating infectious diseases. Granted, the pandemic was a different challenge, but people are living longer because they're not dying of tuberculosis and other diseases that were much more prevalent. Unfortunately, as you live longer, you are much more subject to what your environment is all about. And what we've seen here is an increase in terms of our blood pressure, an increase in terms of weight that secondarily then results in an increase in diabetes. We've seen a rise in cholesterol. The one positive thing we've seen is a decline in tobacco use, although that was a major contributor to heart disease for the longest time. And we are living in an increasingly stressful society where the mental stresses are increasing, and yet our physical stresses are decreasing. So the body is not coping as well. You put all these things together, and the risk factors for heart disease are going up, and as a consequence, heart disease is going up.
Well said. And doctor, I mentioned but how we can be more healthy. But in terms of diet, there are different perspectives on diet. So in today's environment, what's the best diet?
So there really no such thing as a best diet. So I always tell people, if there's a diet that you like, to get a little bit of weight loss, go ahead and do it. None of these diets are harmful in the short term. But the real success in terms of diet is what you do in the long term. And that is, and it's unfortunately, it's all the messages we don't want to hear. And that is a diet that's rich in fresh fruits and vegetables, a diet that keeps track of portion size, so that we're not eating. If we had to do eating all over again, we would not have 3 big meals a day. We would probably have 6 to 8 small snacky meals all day long. A much better way to eat, for your body. Less chances of developing diabetes, less chances of causing weight gain. So it's really about making those right choices and reducing that portion size. Don't deny yourself stuff that you enjoy, but put it in that term that we always hear, moderation.
And that's the key term, moderation, because as there's a proliferation of all different type of diet. You have the keto diet, you have the fasting, where you fast for just eat once a day, and there's several different ways, different diets that people are focusing on. But the consistent thing is just do everything in moderation. Portion size, that's the key.
Absolutely. And as I said, these other diets, there's nothing wrong with starting with those. You lose some weight quickly with many of these diets, and that often is a positive motivator and reinforcer. But if you talk to people that have been on these sort of fad diets, the weight all comes back unless you've made those permanent lifestyle changes. And that also goes, as you know, there's a huge amount of coverage related to weight loss drugs. And while they have a place as well, drugs are never going to be the full answer. It really is about making real lifestyle changes. And they don't have to be all done immediately. It's hard. And so, take it one step at a time, but look at a goal in mind, and try and get there, because it will do you much good in the long run.
Right. And doctor, let's talk about your process, right? Say I'm coming to you today. What's your process?
So I think the first thing I like in terms of what you said is that you are coming to me proactively, because this is what happens. I don't want to have to see you in the emergency department for the first time, in the throes of a heart attack, or presenting with heart failure or rhythm disturbance. And yet it's amazing how many people do not look after their heart. We've gotten used to, women getting their mammograms and guys getting their PSA test and their colonoscopies, but there is no quote heart checkup that's automatically scheduled. You have to be proactive about getting that done. And I really do think that if you've got a family history, you should be assessed in your 30s. And if you don't have family history, certainly by the time you turn 40, you can get a proper cardiac assessment. So when I see you in the office, we get a very detailed history, and trying to identify what your risk factors are. And it's the common ones that we want to make sure about. We want to know about your tobacco. We want to know about alcohol. We want to know about smoking. Blood pressure, your diabetes status, your lipid status. We'll sometimes do lab work to help with that. And then depending on what I identify, we give you a risk score, tell you, this is the potential risk that you have in the next 10 years for heart disease. And then we also can calculate what's called a lifetime risk in terms of heart disease. And then we do some additional testing. We try to keep it simple. An EKG can give you a lot of information. That's just the electrodes that you put on, and literally takes a couple of minutes to get a assessment of your heart rhythm. We'll sometimes do an ultrasound of the heart to look at your heart function and look at the valves and the pumping function of the heart. We'll definitely do a stress test. And yeah, I do what's called a symptom limited stress test, where I really push you. I say, I want you to go longer than you would out on the outside, because I want to make sure that everything is safe for you. And a lot of people want to prepare for that. And I go, we don't want you to prepare. We want you to know that you're safe to do it. And then there's a new test that is called a heart scan, which is a quick CAT scan of your chest that allows us to look for very early plaque buildup. Because one of the dangers about just a regular stress test is that you can sail through a stress test and still have as much as 50 to 60% blockage and not be aware of it, because there's enough blood flow that you will do okay on the stress test. But that calcium score, the heart scan, will pick up that early plaque buildup, and so allows us to be a bit more aggressive about dealing with those plaques. And with proper diet, exercise, and medications, we can shrink those plaques.
Awesome, awesome. And by listening to you, doctor, obviously you have an extensive, steps that you go through to ensure that your patients, they're assessed well and taken care of. So let's shift gear a little bit about your business and your operations, right? And as you know, I'm a digital marketer. That's what I do, help providers scale their operations. But firstly, what if you would say, what was the best, since you've started your practice, what was the best business advice you've received? What that would be?
Well, I think throughout my career, the guidance that I've gotten and the guidance I give, I do a lot of teaching. I have professorships both at Mercer University and Medical College of Georgia. And when I teach students, it's the same advice that I got, that practice medicine to the best of your ability, with the focus being on the patient. In fact, that's our sort of mission statement. It's called patient-centered, evidence-based, holistic care. And I think that's the way I approach people, is you want to know where they're coming from, what are their goals. Evidence-based, I'm a researcher. We do a lot of clinical trials. I have a very active research unit. So I stay up to date on what the latest technologies and therapies are. I want to be able to offer that to patients. But as I said, the patient always comes first, and you have to listen to what they want. And our job is to provide that guidance, provide that advice, but also not be offended if that's not what they want, or they're ready for that. And then the holistic part is, I focus on the heart, but there's a whole body around you. And it's really important that we respect that it all matters. And so it shouldn't just be about the heart. It should be about your whole mental well-being, how you are feeling overall. And so we put all of that into context when we are treating a patient.
Well said, Dr. Singh. And Doctor, you obviously you have been a successful provider, and your practice is very successful. If you could say some of the mistakes you're seeing, like new providers are making, what are those? Maybe one or two.
Well, I think the challenges that we sometimes see in the profession is that we're under a lot of pressure. There's a shortage of healthcare workers. We are at risk of burning out, and I think the first thing I would say is always listen to your own body, and know that that when you're coming into work, that you come in with sort of the passion that got you involved in healthcare in the first place. It's not always easy when you have a huge workload and lots of other external pressures and things like this. But when I come into the office, I almost think of it as a sanctuary that my focus now is looking after patients. Not everybody does that, and if you start letting all the sort of bureaucracy and the frustration of healthcare start eating at you, you will burn out a lot quicker. So I think that's really important, is just that mental framework that you come in to work with. And then the other aspect that I think we have to do better at is communicating amongst each other, amongst other health professionals, and even with the patient. Time is the challenge there, and sometimes there are some roadblocks electronically and things like this. But if we're not all communicating, then we're not all on the same page, and that has an impact in terms of the quality of care that we deliver, the redundancy of care that we deliver, and the gaps that are sometimes occur just because we're not in tune with what others are doing. And we all have to make a much more concerted effort to try and sort of use that, what we sort of call a team-based approach to care.
Agreed. Well said. And doctor, you touched on burnout, because this is a big thing in healthcare. I speak with other providers. It's prevalent, right? How do you cope with burnout?
Well, it's what I said is, when I come to the office, there's a smile on my face. I'm here to work. I'm here to enjoy it, and we have this privilege of there's another place where you meet so many different people at such a close one-to-one relationship. So I enjoy that aspect of spending time with my patients, albeit it's often less time than we'd like. But I enjoy every moment of that. On the other hand, I look after myself. We're about to go on a huge trip to Africa on a safari, and
Nice.
we make time to enjoy life ourselves, because I think everybody needs that sort of ability to sort of recharge, so that you do come back with a positive attitude, because the pressures of healthcare are not going away. If there's one thing I can say on this podcast, that is that I love what I do. I will want to see others with the same passion continue to think of healthcare as a profession to come into. As I said, I do a lot of teaching, trying to encourage people to come into this area, because if we don't, I think it will become a vicious cycle of not enough staff, and more stress on the people that are trying to deliver that service.
Yeah, agreed. Well said. And doctor, let's talk now about scaling a practice, right? And the growth mindset. You've been successful. What are some of the things that one can do to scale their practice effectively?
Well, I think there's no question that we now live in a technological world. I mean, it's amazing, that a good portion of my referrals come from people just Googling and identifying, and believe me, they want to know what your reviews all have to say, and your accessibility, and so I think we have to be cognizant of that is the way that people now seek out information, seek out their healthcare. And so you have to have a good digital presence. I have a website. I do a lot of sort of educational materials. So on my website, there's about 40 different articles on different aspects of cardiovascular disease, and they're designed, written very simply, to allow patients to read beforehand if they want to come and see me, and say, okay, yeah, it sounds like he knows what he's doing, or vice versa. I didn't get to spend enough time with them. I often tell my patients, though, go back to the website, and if I talk to you about hypertension, read my hypertension articles, and they'll reinforce a lot of what I said in the office, but you may just not have had a chance to sort of absorb it all. So I think that's been a very positive thing. I enjoy writing those articles, but I think my patients get a tremendous amount of value from having those resources available. So, another thing though is clearly word of mouth. You deliver good care, and those individuals will pass that message along. And, a lot of my referrals really come from, delivering a positive experience to somebody and then passing that information on.
And that's great. That's great. And it's obviously you're aware of the digital marketing realm, and for you to speak to that, that's really good. But Google is the #1 search engine. And if someone is searching for a cardiologist in the area and they don't know you directly, they're gonna Google it. They're going to Google it, and they're going to see, the cardiologists that are coming up, and look at the reviews, and then they give you a call. So it's as what you said, which is excellent, that it's so important to have that, a good digital marketing or digital presence, so that your ideal patient will find you. When people are looking for you, they'll find you. And not only that, when they find you, just to ensure that your website is a representation of you.
No, I think that's so important. And I think this is again where we all have our expertise. And so, while I have a digital presence, I do look to others to provide that sort of guidance in terms of is my messaging getting across properly? Is the website design appropriate for my patients? Is everything from even font size to ease of navigation, all of this becomes very, very important. And again, we can't be expert in all those things. So, I definitely look for guidance in terms of that. But I think to ignore, not having a digital presence, I think would be a detriment to your practice and to your patients to a certain extent, because they want to, like you said, know about where's my doctor, how can I get to them, what resources do they provide, and the internet is a great way to be able to get that information.
Well said, well said. And doctor, I can't believe we're basically close to the end of our talk here. But tell our viewers and listeners, how can they reach you?
So as said, my website is probably the best way to first see if this is the right practice for you. It's www.heartdrsingh.com. So very easy, all one word, and that's the easiest way. Of course, from there, there is the ability through a third-party appointment scheduler called ZocDoc that you can reach me, or you can directly phone our offices. Our office numbers, our office addresses are available. And one of the things that we do, heart disease scares people. And while many times what you think is the heart may not be, until you know that, it's going to frighten you. And so we really do have a policy of trying to see patients very quickly. Within 24 to 48 hours of your phone call, we will have you in our office to be able to make that initial evaluation and put you at ease. So, we're always looking for individuals to come get assessed. As I said, prevention is the key. The sooner you make that assessment, the better off you're going to be.
Awesome, awesome. And Dr. Singh, thank you so much again, sir, for stopping by. It was a pleasure.
Well, you're very welcome. Thank you so much. Take care.
All right.